welcome to the 2021 Coffin-Siris Syndrome Conference. I am Sarah Rosenzweig in Detroit, Michigan. My daughter is Ella. She is 10 years old and she has ARID 1A mosaic pattern variant. And I'm really excited to be here today to introduce my friend, colleague, and Ella's old speech therapist, Randi Freed. Randi is a pediatric speech and language pathologist with more than 18 years of experience. She is also a mother to a child with autism and 2 other kids. And she's really awesome. I want to give her as much time as possible to talk about the things that you guys want to hear about. Just a little bit of housekeeping stuff. Also, I'm an advisor to our CSS Foundation board, and I'm also a social worker, which is I'm an advisor. Everyone's going to be muted while they're in here, and the chat box is going to come straight to the moderator. So if you type something in the chat, I will see it for questions, and I'll try to get through those after Randi talks, which will be sometime around 2:40. We'll start doing questions and answers. The gallery view will not be on while Randi is speaking, but if you are unmuted, you will be on the video, which is recording. There's also the lobby available to hang out in after and between sessions, and you can connect with other families there. And we are on Facebook and Instagram if you want to follow us. If you're posting pictures, please hashtag myCSSFam and CSSComp to 2021 so that we can see your pictures. If you'd like to get involved with the foundation, there's plenty of volunteer opportunities with fundraising, marketing, research. And if you have other ideas, please bring them to us. We'd love to know. Our email is foundation@coffinsiris.org. And with that, I'm going to let Randi talk to us about speech and nonverbal expression this morning. Thank you for being here with us, Randi.
Thank you so much, Sarah. Sorry, I'm just sharing my screen. So today my talk is on communication and going beyond speech. Sarah already mentioned it, but I'm a pediatric speech language pathologist and I have 18 years of experience. My areas of interest are autism, early intervention, apraxia, and alternative and augmentative communication. I am the mom of 3 kids, age 7 to 15, and my youngest son is autistic. So today I hope to define what I think the goal of speech and language therapy is, to understand the components of a robust communication system, to model building routines around language, and to specify ways to build connection and to expand communication. First, I'm going to start out with the background of communication. It's generally thought of to be made up of 3 parts: speech, the sounds we make, how we put them together to form words and phrases; expressive language, the output of words, phrases, sentences to request, to share thoughts and ideas. It can be through speech, but it can also be through sign language or augmentative communication. And then there's receptive language, what we're comprehending the input of language, understanding of words and gestures, directions, and questions. It also encompasses understanding grammatical structures and concepts like spatial directions and social language rules. And so many things are communication beyond just speech. We all use varieties of communication, whether we're typing for emails or text messages, whether we're using an augmentative communication device, our facial expressions, our behaviors, sign language, our eye contact and our eye gaze, and also gestures like pointing. And a speech and language delay occurs when a child doesn't meet any of the milestones in any of the 3 areas of communication. So in a speech delay, we would say a child hasn't develop sounds as expected. They might be having trouble combining sounds. They might substitute one sound for another, like T for K, like T for cookie. Functionally, this may cause reduced intelligibility and frustration when they're trying to communicate with others. And apraxia of speech also falls under this area. And apraxia is a motor speech disorder caused by the difficulty coordinating motor movements to form sounds and words. And a little chart on articulation versus apraxia. Articulation are consistent airs, and they also often follow a pattern, like leaving off a sound at the end of words or consistently using T for K. But with apraxia, those airs are inconsistent and they're not always following that pattern. K might be T sometimes, or it might be another sound, or it might be left off altogether. The airs are consistent in articulation delays, no matter what the length of the utterance is. But with apraxia, we often see as the word or utterance length increases, those airs also increase. Articulation delay, we see normal prosody of speech, which is that sing-song of language. But with apraxia, we hear prosodic airs. So it might sound more robotic or slower, or it just doesn't have that regular sing-song that we expect in language. With articulation delays, kids generally don't have vowel airs. But with apraxia, vowels are often simplified. E or A might be like a schwa sound instead of their tense vowel sounds. And then articulation delays have the same airs, whether it's automatic speech like singing, or just phrases that we use a lot like hi, how are you? Whereas in apraxia, sometimes that speech is easier. So singing might be easier. Phrases like how are you? I'm good. Those kind of things sometimes come out easy, whereas other phrases are hard. And also in apraxia, we see groping for sounds. Those speech muscles are sometimes trying to catch what you're trying to say. And sometimes we hear pop out words. So we hear words that they can say one time or a few times, but we can't get them to repeat them or say them, and we don't hear them consistently. And then an expressive language delay is difficulty using words, phrases, or sentences to communicate needs or ideas. They may have problems with the structure of language or the grammar. It could be word finding problems, and it's often, but not always, secondary to a speech sound delay. And then receptive language delays are difficulty understanding gestures and words and phrases. And children may have difficulty understanding that social use of language as well. And it generally occurs with an expressive language delay because receptive language development precedes expressive language development. So we usually understand something before we use it. Speech and language therapy is there to help children and family increase communication success. It should be family focused, child-centered, generalizable, and the progress is measurable with attainable goals. So family focus. So for me, this is important. Therapists and families can discuss communication success and difficulties. Parents, you are an expert on your child and you know where they're struggling the most. And then the therapist is there to help you see where in the language it is. But really, you know your child the best. And therapists can help work with families to identify the most important goals, what will make the biggest impact, where are they, struggling the most to get their ideas and needs across. And then therapists work with families to target goals in therapy and in the home, because kids are with their parents or caregivers the most. And goals that are helpful will carry over the most into the home and into other settings. And then it should be child-centered, so following the child's lead. Kids learn the most when they're interested in an activity and they will pay the most attention, and the language that you use will be most salient to them because they are interested in what they're doing. And we want to meet the child where they are at the moment. So we want to accept the child as they are right now and not try to change or fix them, but to just enhance their communication skills. And then, of course, we want to provide that just right challenge. So we want an activity that's slightly higher than they're doing right now, but not too hard or too easy that they either get bored or just frustrated. So maybe if they're using one-word phrases, then we want to push them to 2 words. Or maybe we want to add an ing to their verbs, maybe, if they're using single verbs. But kids first need to communicate on their own agenda before they're willing and able really to follow somebody else's agenda. And then we want those goals to be generalizable, because if they can't be used when you're out of the therapy room, then they're really not useful. So we want the family to be able to implement established goals into their routines at home. And we want those skills to be able to be used at home or at school or wherever the child is. And we want overall autonomous communication to increase. So we really want kids to be able to use their own language to tell us what they need, to tell us their stories, and just to really relate to us, to be able to be there with everybody else. Language is really about forming those connections. So when they have that autonomous communication, then they're able to form deeper connections. And then we want them to be measurable and attainable. So we want goals that are in the zone of proximal development. So that just means that if we think of 3 circles and one in the middle is what the child's already doing, and then the one right above it is what they can do with help, and then the last one's something that they just can't do yet. So we want to work in that second circle of what they can do with help, and then push them to be able to do that without help, to get rid of those prompts and to make it attainable for them. And we want goals that can be measured, and sometimes we measure those with percentages, but also hearing how they're using it at home. I think that's also important, in hearing those success stories as well, because sometimes we don't see that as much. And then goals are changed and adapted when progress is stalled. And I think this is important to know, that children can always learn, but maybe we're not working on the right thing if it's stalled. So if somebody says, well, they're not really doing this right now, well, maybe we need to change that goal, because maybe it's either not important for them, or they're not being engaged in that goal yet, and they're just not being able to reach it yet. But it's not something about the child that they can't learn, that children can learn, and they just need to be presented with the right challenges. All right. I don't know why it's not moving. I'm sorry. Oh. Yep. Sorry. And then we want to respect all communication. So, again, I mentioned this before, that communication is not just speech, but it's all the gestures and facial expressions, augmentative communication, sign language that we use. And when we respect how a child chooses to communicate, and we acknowledge what they have expressed, they will be more likely to engage with us further. And if they didn't express themselves in a way that we're really pushing them to do. So maybe they're pointing and grunting, but we wanted them to use a word, then we can model the mode that we're really looking for. Like if they're pointing at the cookie, oh, you want the cookie. Oh, cookie. And they hear what we wanted them to do, but we don't frustrate them by, making them say it differently each time. My next few slides are from the book Knuffle Bunny by Mo Willems, and they show a communication breakdown. And so if you're not familiar with the book, Trixie and her daddy have been on an errand together. They went to the laundromat, and when they left the house, she had her Lovey, her Knuffle Bunny, with her. And right now they are on their way home, and Trixie has a message for her dad. And she says, "Oggle, flaggle, claboggle." And her dad looks at her and says, "That's right, we're going home." But he does a great job at responding right away and honoring her communication, but he didn't stop and really look and see that she looked a little bit upset. She didn't look like, oh, she's telling me, oh, we're going home. But so he misses those facial cues, and that's part of that communication. And then Trixie happens to be a really good communicator, and she is able to repeat her message and add a gesture to show urgency. And she says, "Oggle, flaggle, claboggle." And now Dad does look, but he has no reference because what she's talking about is not right there. So it makes it more difficult for him to figure out what she's talking about. But again, Trixie is a really good communicator. So she changes her message and uses more precise gestures. Flaggle, flaggle, Wumpy, flappy. She's pointing in the direction she wants to go, but Dad just doesn't get it. And then she starts to cry. And then finally, the message fails and they both become frustrated. And Trixie's communication is now in the form of a tantrum, which is a behavior showing that she is really unhappy and that Dad does not understand her. And, I think this is something we can all understand when somebody doesn't, when you just not understanding something. You're frustrated and the child is frustrated. But as soon as they get home, Mom opens that door and she says, "Where's Knuffle Bunny?" She knew right away. So if she had been there, this exchange probably wouldn't have happened because she's probably the caregiver who's with Trixie the most at this point, and she knows what to look for. And usually children have a caregiver who is able to figure out their message almost all the time, but sometimes that communication partner and caregiver isn't there. And then those messages get lost and we become frustrated and the kids become frustrated. And that's where augmentative and alternative communication can be really helpful. And augmentative and alternative communication is all the ways that we communicate without speech. There's aided communication, which is when we use a tool or device that helps us to communicate. It can be high tech, like a speech generating device, any kind of device that we hear speech when it talks when we push the buttons. Or it can be low tech, it can be a picture board where you can touch the pictures and you're watching and you can see what pictures we're touching. Or it can be unaided communications, gestures, signs, facial expressions. And it may replace speech or it may just add to speech. So what are the prerequisites to alternative and augmentative communication? There aren't any. There are 0 prerequisites. You do not need visual discrimination skills or motor skills or certain cognitive skills. They don't need intentional communication yet. There's no age that's right to start. You don't need to identify pictures or have cause and effect because it's really a catch-22 where sometimes you can't determine the level of expressive language because there's no way to see it if they have never been exposed to another system besides speech. And if speech is not a viable option or they're not using it enough, we might not know what there is for them to say. So there are no prerequisites. We don't wait to talk to a child until they can speak, and just like we don't need to wait to use augmentative and alternative communication until a child can. So the goal of an AAC system is to allow for autonomous communication with the ability to connect with others. It's not learning how to use the technology, but using it to communicate. So we want a robust system that will have lots of words available. It will have core words. Core words are the words we use 75 to 80% of the time, and fringe vocabulary, which are the more precise words in our vocabulary, which really make up about 20 to 25% of our communication. So we can make a whole sentence with core words. It would be, I want that, there it is, don't do it. Those are all just sentences with core words. And fringe words really help make it more precise, but those core words are important because there's really a lot you can say with them. And then we, of course, want varied parts of speech, nouns, verbs, and adjectives. We want it to be able to be used for a wide range of communication functions: commenting, agreeing, negating, questioning. We don't just want it to be used to request or I want. A lot of times we get stuck in that I want or just requesting objects phase, and we really want it for a variety of communication purposes, whether it's labeling or commenting, agreeing. And we wanted to support the organization of conversation, so in language. So oftentimes communication devices are set up where the left side is the people or the subjects, and then in the middle there's verbs and adjectives, and then on the right would be objects, so that you can make a sentence like I go home, so that it's easy to flow with that conversation. Other things a robust system has would be supporting grammar. So although you might not be using it right away, we don't want to switch systems on kids all the time, because that would be learning like a whole nother language. So we want it to be able to have it even though you might not use it right away. So plural S, past tense, ED, ING, all those things, so that grammar can be supported later on. And we want an option for pre-programmed messages. These are things that are urgent and time sensitive that we might not have time to type each word out in, but are used often and help kids stand up for themselves. So it might be something like, leave me alone, or that's not what I meant. Other things are, stop talking about me. A lot of times when kids are nonverbal, we tend to talk about them when they're around, but they often understand and have no way to tell us, I don't want you to talk about me, include me in the conversation. Or it could be something like, I'm uncomfortable, help me move. We want the organization to support their motor planning. It's kind of what we talked about before. And we want it to have full alphabet and word prediction, so that, again, when they gain skills, they'll be able to, they could type words, or like we do on text messages, have word prediction as they grow up, and individual access methods. So if they can't touch those pictures, they can always use eyes gaze or scanning. There are so many ways to access it. And then we want it to be always accessible with them all the time, so that they can communicate whenever they need to. Some examples, this is no way comprehensive, but some examples of robust systems are ProLopo to Go, Word Power, Unity and LAMP, and Touch Chat with Word Power. But if you have a system that's working for you, that's great. There's no need to change to one of these systems, but these are just some examples. And of course, a system should be picked based on individual needs and chosen with a speech therapist. And when can I start AAC? So there's, again, no specific age. It can be started any time, and it can be started when speech production doesn't meet language demands. So those sounds are hard to produce, or we're not understanding, it's not intelligible. So they might have some sounds, but they're not able to use it all the time. The system can help to get their point across and to even just build that language. And then when communication lags in some situations, so maybe communication is great at home and they're able to talk and able to use those, what they need at home, but maybe not at school. And we want them to be able to have that with them so that their communication anxiety doesn't take over and they're able to communicate whenever they need to. And it's just never too late to do that. So a child can learn and practice speech while they learn language on a device or with a picture system. And AAC will not hinder or reduce speech production. So some people are afraid to start it because they think, well, if I use pictures, my kid's not going to talk. But it's just not true. It's been studied a ton, and speech is the most efficient way for us to communicate. So if a child could use speech, they would almost all the time. And oftentimes the research has shown that AAC supports speech production and will help kids learn that. It really just slows us down because it is a bit slower to use. And I think then they hear those sounds and are able to slow down themselves as well. So how do I start? So after you and your child's team choose a device, you can start modeling without expectation. So that means you do the modeling. Make it available all the time and focus on connecting with your child. And again, just keep trying because it won't feel natural to you right away. It is new and it is different. So how do you use your learner's device to model? So you and your child have spent years listening to speech and listening to people talk. So again, just like for you, AAC is new and different for your child. So it takes time to get comfortable with the device. So it'll take time for you to get comfortable and it'll take time for them to get comfortable. So you can start with one routine and start modeling language, and or you can start with like one page on there so that they can start seeing that it works to communicate. And it doesn't mean not to talk with it. It just means to use it while you're talking. So you could be, it could be bath time and you could be taking a bath. And if you have the device or even you can print the pages from them, you can say, wash hair. You can push those buttons so that they know that what you're doing. And or stinky, like things that are fun that will make it kind of fun to go back and forth with. But at this point, you're not expecting them to do anything but hear it. And again, you don't have to start with full sentences. You can use 1 to 2 word sentences, and then in your verbal language, you can start still give them those examples of longer sentences. And then more things to think about is just don't worry about doing it right. There really isn't a right way to do it. It's different for everybody. And you sometimes, and if you're just using it and modeling with it, then you are doing a great job. And then you can involve the whole family. So some of these systems can be used on like an iPad or other device like that. And if you do download it that way, like on like any other app, you can put it on more than one device. And so then they can see more than one person using it. And again, like siblings and friends are great natural models, and we're not asking them to be teachers, but they can use it, with you so that the kids can see that it's not just for them and that everybody can use it, and it helps everybody communicate. And then the more you do model, the more natural it will become. And we want to make it fun because we want to remember that communication is about connecting. We want to get our messages heard, and we want to hear what our kids have to tell us. So, and when we respond to our child's communication attempts, they are intrinsically rewarded and will try again. So if no matter what way they're communicating, if we respond, they will do it more. And then if we respond and then model how we would want them to say it. So maybe with a word on the device, then they're, hearing that as well. And they will see like, oh, when I tell them this, they get it. So they will understand that. And AAC, again, is always available. We never want to remove a child's voice. We don't take a kid, we don't tape a kid's mouth. We don't, we'll never do that. So we don't want to ever remove their device as a punishment. We can problem solve to remove those barriers and work on, if they're, pushing buttons and it's just loud, we don't want to turn it off. We just want to work on, it's time, it's time to be quiet now. We can, we'll talk in a minute. Let's listen now. The same way we would do if a child was talking and we needed them to listen. And again, if we want it to be always available and again, about bath time, you can print those pages, put them in page protectors or laminate them and have them up in the bathroom or have a page on the refrigerator. So if they're not carrying the device with them all the time, there's always a way to communicate. And again, how I said it, make it available in all environments with all communicators throughout the day. So if they're going to school, it's in their IEP that they have this all the time. And again, if you're thinking about it and they're having trouble using it, there's always a way to solve it. It's never the child. They can learn. And then don't give up, because the longer you practice, the easier it will become, and it can take up to 245 days to form a new habit. So the more we do it, the better we'll get at it and the more natural it will be. But what if? So we're always thinking, what if we have one and my child presses the same button over and over again? Well, it could be because we're not understanding the message they're giving us. They could be saying potato chips and you're saying, well, you want potato chips, but maybe it's that they don't want potato chips, or that they want different potato chips, or they're just showing us the potato chips. So that could be why they're pressing the same button over and over again. We're not understanding their message. They could be pressing it because they're playing with language. They might press all different buttons just to hear them and see what they are. And it's kind of like when a child babbles or uses jargon or just lists the words that that they've learned. Babies do that all the time. They will say a list of words they're doing, and we really need to let kids play on their devices as well, so that they can learn where things are and learn that they can communicate with it, and that it is, fun to communicate with. And what if my child already uses some words? We already talked about that, but again, if they're not using words consistently, or they're not using as many words as we would think they might be able to based on maybe their receptive language, what they're understanding, then an augmentative device might help them build that expressive language while they're working on their speech. So it, again, it won't hurt or stop them from using those words. And then what if they don't reliably make choices right now? It could be that you're not offering the choice she wants, and maybe having more words at her disposal, she will be able to choose what she wants. She may have changed her mind in between choosing and when you give it to her. And it might be access. Maybe, again, they don't have enough words to find what they're trying to tell you. What if they can't push the buttons? There are so many ways to access AAC, whether it's scanning or we can use a tapper. There's things that even pointers that can go in your mouth to point with if you can't use your hands reliably. There's eye gaze. So that, and then what if you get a device and your child can tell you something new? And that's really what's most exciting about it, because you don't know until you have a new way to talk or communicate. Routines are great ways to use devices, and because they're predictable and repetitive, children are able to anticipate what happens next. So then we can wait and see what they might have to tell us. They help children understand what will happen in the world around them, and they have a beginning and an end. And they can use short, simple phrases to narrate. We can use short, simple phrases to narrate what's happening in those things. Some of my favorite routines to start with, I've mentioned bath time a few times, but it tends to be fun for little ones unless they really don't like bath time. But and they also tend to be in a small area, so they can pay attention to you. Snack time's also great because we're not necessarily working on nutrition at snack time, but on eating things that it tends to be when they have foods that they like, and they might want to request more of, or something different. And it's generally a fun time. And something I like to do is maybe sing a song to start or end the routine, like this: now it's time to take a bath, take a bath, take a bath. Now it's time to take a bath. Let's go upstairs. And then they're hearing it, and it's slowed down, that language. And that sing song sometimes helps with that understanding as well. And then some tips for success. Again, the goal is autonomous communication. We want kids to be able to choose how they communicate and what they communicate. We're not teaching a specific device or communication modality. So we don't want to make it feel like work. We can practice it really anytime. So, we can, use devices and language to talk to them while we're, watching a TV show with them. Anything listening to music, anything that's fun for them. Is when we can really use it. And being playful and focusing on connecting with your child is really how they will learn. Because if they're having fun and you're having fun, they're going to be more apt to pay attention, and they will then really learn that language and take it in. And we want to, again, accept all forms of communication. We don't want to make them repeat themselves all the time. It gets frustrating, and you wouldn't like it either if you're, well, why don't you tell me that in a different way every time you spoke. So if they point and, make a sound, we accept that, and then again, model. And then we can model and scaffold the communication just above their current use, so that they can hear how to communicate next. So they're pointing and grunting for cookies, and we say, oh, cookie, you want a cookie, cookie. So they really hear that word, or on the device, we could do that as well. And thinking aloud. So sometimes we think about how we're doing it. We can tell them how we're doing it. So, oh, I think you want to tell me something. You could use your talker. You want something to eat. Let's find that page. Oh, here it is. And we're really, showing them and thinking about how they're doing it at the same time as we're doing it, but not necessarily making them do it, but they're watching and learning. And then instead of questions, we can use declarative statements, because kids with delays are often tested or questioned a lot, which puts a lot of pressure on them, and then they often back off and don't want to participate. But making statements about what we see and what we're doing, and then offering wait time to see if they have something to add, or see which way they communicate, really gives them a chance to do that without all of that pressure of questions and testing, and just to see what they know. If we know something, we can state it for them, especially if they know we know. Like if we just ate lunch with them, we don't want to say, oh, what did you have for lunch? Because they know we know what they had for lunch. So now I would love to answer your questions, and I also put my email at the bottom of the page. So if you have any further questions, you can email me as well.
Randi, would you like me to field you questions?
That'd be perfect. Thanks, Sarah.
Okay. So Shauna asked earlier, she said, I have a 6-year-old boy with ARID 1B, and he talks a lot, but it's difficult to understand because his speech is nasal and breathy. How can we help him improve his articulation? And ENT said there's no physical defects, and he does see a speech therapist right now weekly.
Okay. So hopefully with the speech therapist, some things that I would work on with this would be awareness of it. So is he aware that the air is coming out his nose rather than his mouth? Some ways to do this is to hold like a CD, an old CD under your nose, because while they're talking, then the air will go on it and make it kind of fuzzy so they can see it, because that's a visual way to help increase that understanding of it. And then also you can compare similar words that are nasal versus non-nasal, like mud versus bud. So let's see if he can even, just pick those out. So identifying, okay, I'm going to just saying the words first and then in phrases, so that we know that they're understanding that there's a difference between those nasal sounds and those non-nasal sounds. That makes sense.
Thank you. From Lata, we have, what do you think the most likely reason for our kids not speaking?
I wish I could tell you there's so many reasons, again, that kids don't verbally communicate, whether it is that apraxia of speech where they can't, that motor planning is poor, and then they can't get those sounds out even though they want to and know what they want to say. But
I feel like this might also be a good question that we can continue in the lobby afterward, because we did have a neurologist speak on this a couple years ago at one of the conferences.
Okay.
And he had some very interesting information. And I'll also find out if we can post that again somewhere where people can access that. We are on short time. I just want to remind everyone that we do have to end promptly at 2:59, but we can continue this conversation in the lobby. The next question is from Inger. She says, is there a certain cutoff for speech? Like if a child doesn't speak by this age, they most likely are not going to speak.
So, no. So when I first started, I feel like they used to tell us that if a child's not verbally communicating by 4, then it's unlikely. But I feel that like the longer I've worked, I've seen kids speak after 4 a lot. And I've also, the more we learn, the more kids are still learning their brain. We have brain plasticity for so long. But again, I would focus on communication over speech. I know that sometimes that's hard to think about, but when we're focusing on communication and connection, I feel like we get further with our kids and we really form those connections better and realize it's not how they're communicating, but what they're communicating.
Thank you. Kim asked, how do we help the child who can talk on a streak when involved in spontaneous speech, but who freezes when asked a specific question on demand?
Yeah, so sometimes practicing before so that they have that skill, because sometimes kids really, and if they are communicating on their own terms, that's great, because that's really where communication starts, is communicating on our own terms. But that demand is sometimes a lot harder and takes practice. And so really modeling those answers for them, giving them extra wait time. Sometimes if it's a big problem, again, I'm a big fan of, you can augment their communication with a device as well, or pictures. Pictures sometimes help, so you can practice that, having the pictures, and then eventually they might not need to have them there anymore, but it might just help them organize their speech.
Thank you. Richard asked, my daughter used to babble when she was 2 to 4, then she stopped. She's now 7 and makes no sounds other than cries and laughs. Is it likely she'll remain nonverbal? Did we miss a window of opportunity?
I don't think you missed a window of opportunity. Some kids do babble as infants, and then they do stop because they just don't have that need for that input anymore. But again, I would focus on getting the communication that you can, and looking for those nonverbal cues and using an alternative communication system, because that will help build connection and independence, and help you understand her thoughts more.
Thank you. Inger again asked, is there a test for apraxia? How do you know your child has apraxia?
So it is difficult to sometimes to see apraxia versus articulation delays or just language delays, but you really need an evaluation with a speech pathologist or neurologist. Some states, they don't let you speech pathologist. I know when I worked in New Jersey, they didn't let us diagnose it, but in Michigan we can. But those groping movements are often a good a good cue. Also, kids who have apraxia sometimes don't babble as much as infants. They're quieter. They might have, again, those words that you hear, but you don't hear again. But Can they imitate other movements with their mouth, like opening their mouth, sticking out their tongue, moving it back and forth. With the kids with apraxia, that's harder to do as well. And sometimes they have apraxia throughout their whole body, and you can see that in difficulty completing motor tasks. So like getting dressed, or, knowing to go to the door next to, we're going outside. Well, sometimes it's not an understanding of that you go to the door, but just that motor planning to get there.
Thank you. Matt has asked, what are the best devices to start using with a 15-month-old?
So, so some of the examples I gave, so you can start modeling that early, and some of the ones I showed, there's Pro-Loco to go, but I would work with a speech pathologist to pick one out. But that's one I like. It's on the App Store. Also, Lamp is a nice one, Unity or Lamp. But you just want one that you can grow with. So you might not be using a whole lot of words right now, but then we don't want to switch. The different systems might use different pictures, and we don't want to keep switching them on them. But I think it's great to start early.
Thank you. Molly has asked, my kiddo seems to show signs of wanting to use his voice, but no intelligible sounds come out, yet he's 4 and works with SLP every week. What should we tell the SLP to work on with him to best help him learn to speak?
So I would imitate what he's trying to imitate to you. So if he's saying something, then imitate back, and then see if you can go back and forth to build on that, and then change it a little bit if he's not imitating on demand yet. And then again, I would keep working, work on those sounds he has and building from there.
Thank you. And then just a little mode of hope here from Keely, who posted that her daughter was 8 before she started verbally talking.
Yeah. So kids do, you don't know. We don't know. The brains are magical. So we can always build connections, and I would keep working on that communication as opposed to you can definitely work on making sounds as well, but don't forget that we want to work on that connection and building that language as well.
Brains are magical. It's a beautiful way of putting it.
Yeah.
That is all the questions I have. Wait, we have one. Nope, that's it. Those are all the questions we have. We are getting very close to the end of our time. If anyone has one more question they want to put in the chat, I will look out for that. I just want to remind everybody that, we can continue these conversations in the lobby. We had some great conversations yesterday. It's a great place to talk to other parents about what their experience has been. Randi, I don't know if you're available, if you'll be there, but if not, she's posted her email address, randifried@gmail.com. And I do have a question here. Sorry. Oh, Molly posted, they use a Speak for Yourself app since their child was 2, and it's great. And Keely posted, we recently started with a communication device and have already noticed a lot more verbal talking, and she's 13. That's amazing.
Yeah. I think I hear stories all the time, like, oh, my kid, just told me I love you, and they hadn't done that before. And just seeing, what they can ask for if we give them a way to do it and what they can tell us. So
I want to give one more reminder that I forgot to give at the beginning, which is that these sessions are recorded, and there will be versions that are in other languages available at a later date. So if this English is not your first language and you've had difficulty with some of the presentations, they will be available. I can't tell you when yet, but we will keep you posted. They'll be available in other languages. And if there are not any other questions, Randi, is there anything you wanted to say wrapping up?
No, I just want to thank everybody. I really appreciate your time, and I hope you got something out of it. And I can stick around for a little bit in the lobby.
I was muted. I said thank you.
Oh, thank you, Sarah.
Forgot to unmute myself. Sorry about that.
It's okay.
I
Stop
don't.
sharing.
Thank you. I'm going to mute myself while I ask if they're going to end the session or if I need to, and I will keep an eye on the box. What is the someone asked, what is the panel discussion about for the adults? I believe they have people sent in questions that they wanted to ask our adults, and they're going to be responding to some of those questions. And you'll be able to ask questions to some of our adults about what their experiences are and how their life with Coffin-Siris syndrome is. And then, let's see. Okay. Zach, thank you. Guys, if you want to continue to talk with us, we're going to go to the lobby and we will see you there. Randi, thank you so much for your presentation today. As wonderful. You are awesome as usual. And I will see you soon.
Thank you.